Health Secretary Matt Hancock has twice lifted the hopes of a locked-down nation by saying a vaccine will be ready for rollout early next year and lead the cavalry charge alongside mass testing and improved hospital care to bring the pandemic to heel. But virus experts warn a Covid-19 vaccine won't be a universally available one-shot wonder that'll swiftly allow millions to return to normal life. The Evening Standard's health editor Ross Lydall was told it could be 18 months before a vaccine is widely available. He joins me now. Ross, since early on in the pandemic, we've heard a vaccine could be ready within the first few months of 2021. So why are ministers under fire?
The reason ministers are currently coming under criticism is because of the idea that the cavalry is coming. And this idea first came from Matt Hancock, the Health Secretary, a couple of weeks ago. He said this on the Today programme, and then he repeated the same phrase on the Andrew Marr show. And basically, until there was an article in the Financial Times earlier this week, people were rather taken by surprise at this idea that the vaccine would not be rolled out to the entire population, because I think that many people felt that that would be the case.
So what are the health experts warning?
The warning from experts is really the sense that they are cautiously optimistic, but they're urging people not to get carried away and not to believe any sense that life will return to normal in 6 months, that it's simply not practical or likely that basically come next March or April that we'll all be standing outside a doctor's surgery waiting to get vaccinated and get a jab in the arm, and then everything can get back to normal and essentially the pandemic will be over. They really are urging a reality check on, saying, one, that it's certainly not the case under the current plans that everybody will receive the vaccine, which may come as something as a shock to many. And secondly, that we really can't be sure that there will be a vaccine that is usable or fully effective anytime soon.
Now experts are saying this, do you think the Health Minister and others will change their tune and start tempering people's expectations?
Well, George Osborne, our Editor-in-Chief, wrote a very interesting column in The Standard a couple of days ago saying this is really heading to be an enormous political headache for the government, because if the population at large expects to be able to have a vaccine in 6 months' time and suddenly realises that they're not going to get it, especially the working age population. This is a key point. It's going to be an almighty political dilemma for the government in essentially telling people that what they may have been thinking is not in fact the case. Because the reality is that only a week or so ago, the government's advisory panel on vaccines drew up a list of a sort of 11 stage priority list in terms of who's first, who's second and so on. The people who will be first are the old people in care homes and the care home staff, which may make obviously perfect sense in terms of these people are most at risk of dying. But it did say that basically people under 50 with no known health condition or no sort of risk factor in terms of COVID will be last on the list. So a lot of people will be getting the vaccine way ahead of, if you like, young Londoners out and about, people going into the office or on the tube every day.
You spoke with Dr. Nuria Martinez-Allier, who's a consultant in children's infectious disease and immunology at Guy's and St Thomas's. What path does she see the vaccine taking?
Now, the great unknown about the COVID vaccine is that we don't actually know which one's going to be the winner. There are a number in development. There's probably about 200 different trials across the world. There's 6 main trials in the UK, of which the Oxford trial is the best known one. That's the one that's thought to be furthest ahead and most likely to actually come up with a usable vaccine. But essentially what Dr. Martinez-Allier was saying, as were colleagues as well at the London School of Hygiene and Tropical Medicine and so on, was that the key thing about the vaccine we don't yet know is whether it will be useful in preventing people who contract COVID from becoming seriously ill, or whether it will actually limit the transmission of COVID between people, or whether it can do both. And of course, if it can do both, it's perfect in the sense that it should basically prevent people passing it from one to another, and therefore will sort of quash the pandemic and also ensure that should somebody inadvertently catch it, then it really shouldn't be badly affected. But the likelihood as well is that the vaccine, or certainly the Oxford one, may not be as effective in older people as it may be in younger people.
She also describes the development of the vaccine as an orchestra. What does she mean by that?
Yes, basically what she's saying is that these vaccines will go through a number of iterations, and it could be that the first version of the vaccine may be good enough to release widely, and it will be safe enough to receive approval, but it may not do everything you want it to. So her comparison was that it's a bit like trying to set up an orchestra to play Beethoven's Fifth Symphony. And obviously you need many instrumentalists. And she's saying at the start, the first version of the vaccine could essentially be something like, yes, you'll have a conductor, you'll have a violinist, and you may have a drummer, but you won't have any of the other parts of the orchestra. So the sound that you'll get, you may get something vaguely resembling the tune, but it won't be anything like what you want it to be. So it may take several iterations of the vaccine before we get a full-blown symphony.